welcome to our inaugural Addiction and Mental Health Symposium brought to you by Connections in Recovery and the UCLA Department of Psychiatry. So let's put ourselves, all right. As I look about in the audience, this literally is like a who's who in addiction treatment and recovery and advocacy. So wonderful to see so many friends and colleagues and soon-to-be friends and colleagues. So welcome to UCLA. Again, my name is Dr. Timothy Fong. I'm a UCLA addiction psychiatrist. I've been here, believe it or not, 20 years that I've been working in this field of addiction and treatment recovery. So about 10 years ago, I first met Patty and Lauren, and we really hit it off. But through the years, it's really merged not only professional, but also a personal friendship and relationship, and we're really proud to work together. About 2 years ago, we thought, how do we blend together academics, private, nonprofit, and all the best people out there to do a better job here in Los Angeles, to do a better job of treatment, prevention, education, and research on addiction. And that's how we came on to our current collaboration. So we do have a collaboration between Connections in Recovery and ourselves here at the UCLA Department of Psychiatry to do exactly that, to do research, to bring scientific products related to addiction and treatment out there for the public, the private, and for families to use. And one of our first things we thought of is let's put together a mental health, addiction and mental health symposium, and let's talk about some very key topics. Now clearly things that are happening in the addiction world are so fast-paced, right? Every day you look up, you see news stories. Every week you hear some new gossip about something happening at a local treatment center. And we said, what are the three most essential topics in 2017 that we're seeing not only in our office, but in research in the hospitals? We came up with three. There's a million, but we came up with three. We said, number one, digital technology, digital health. Number two, opiates. Not just opiates, but working with the family members of men and women with opioid use disorders. And third, cannabis. With the legalization of cannabis here in California, we thought, let's talk about those three things. Now, at first glance, you may say, they don't make any sense, they don't relate to one another. You got iPhones, you got opiates, and you have pot. Well, they absolutely do talk together, and that's why we want to bring that together. The purpose of today is to learn something about these very, quote, burning issues that are happening in Los Angeles, but more importantly, it's to make friends. It's to connect, not only with old friends, but make new connections. You know, about 10 years ago, when I was looking around, I saw at least 400 substance abuse treatment programs in Los Angeles. It was impossible to know that. And here I was going about as the addiction expert, and yet I didn't know these programs. So through this effort, we want to get to know programs together. So this is the start of relationships. After our formal program, we do have a little networking outside here, so you can exchange business cards. And after this is all done, we're going to have the presentations on the Connections in Recovery website. And we certainly look forward to meeting and having a second event about a year from now. We do have one quick announcement. We have CEUs here. Thank you to Nadia and Dan for manning the front table. If you want to get CEUs, you have to sign in and sign out. So with that, let's go ahead and get started. We have a very fast show here. We have four presentations here. And before we get started, we're going to start with Patty and Lauren. I'm going to talk to you about Connections in Recovery, and they're going to share a little bit about some of their work too, and then we're going to go right into the presentations with Dr. Grant. So without further ado, Patty and Lauren of Connections in Recovery.
I want to thank everybody who came out today. My name is Patty Baret, and I'm one of the co-founders of Connections in Recovery, and Lauren Arborio is the other co-founder. I've been around the community for over 31 years, and I've seen the development of crisis case management and sober companions. And I wanted to make sure that we equip our sober companions because they are the eyes and ears for psychiatrists and therapists and can observe, document, and report. I am lucky, I feel very blessed to have such an amazing team. You're going to hear a little bit later on from Dr. Georgina Smith, our clinical supervisor, and from a couple companions because they really do the work. So I'm going to let them share a couple case studies with you. These are case studies that we are providing to UCLA for research. And I'm going to let Lauren have a few minutes, then we'll introduce Lauren Casey and London Reber.
Hi, I'm Lauren Arborio, co-founder of Connections in Recovery, and I started... I started working in this field 10 years ago. I started working as an assistant to addiction psychiatrists. And I didn't even know there was a specialty for just addiction in psychiatry. I had no idea. I had been sober for a while, and I'm like, wow, this is so great. And yeah, I can be this person's assistant. I know about addiction. So I worked for two prominent psychiatrists in Los Angeles, and they had their private practice, and they also worked for several treatment centers. And through working with them, I really got to be in contact with a lot of families, and families that didn't live in LA, but their children were here. And they were overwhelmed, and they didn't know what to do next and where to go, and they just needed help. They needed a support system. So I thought of the idea of Connections in Recovery as to help families find treatment, whether it be inpatient, outpatient, psychiatry, sober living, a place families can feel safe and trusted that they can go to help be their advocates throughout the process. So that was the beginning of Connections in Recovery, and we are doing it now in our 7th year, and we are helping families all around the country find treatment, helping them get into the right hands and not the wrong hands, and just really providing that special support needed. There's a funny story. Dr. Fong keeps asking us to do a Zagat guide of treatment centers, and I mean that is just way too overwhelming. So if anyone wants to take that project on, yeah, that overwhelms me. But anyway, thank you all for coming today, and we hope you enjoy our show.
Hi, I'm London Reber. Hi, and I'm here to get you familiar with what is a companion. We actually originally started as a recovery companion for someone that the clinicians can turn to, that they recommend to the families who need extra support. So the companions will structure their time, their day, essentially at that time, their life, around what the client's needs are. So as to develop a human connection one-on-one that can assist with the treatment and really elevate the possibility for success. Companions stay with the client sometimes a day, a week, even months, anywhere from 3 to 24 hours. They are there to observe and report the client's behavior, the challenges, family dynamics, sleep patterns, hygiene, unhealthy friendships, and even the possibility of technology addiction. They also redirect when the client has racing thoughts, as well as triggers arise throughout the day. Even standing in line can become overwhelming for certain people, and to have someone there to walk you through it can make all the difference. Psychiatrists have called us for companions, for example, when a client has escalated at, say, 9 p.m., and one of the only other options up until now is to hope that they stay safe, or suggest that they self-admit. In this case, they can refer Connections in Recovery to reach out to the family. The family can reach out to Connections in Recovery. A companion can be sent to the house to contain them, keep them safe, and help them arrive at their appointment first thing in the morning. Companions stay with the clients during detox and can provide doctors consistently with updates on vitals, keeping medications, logs, and making sure that they're compliant. Companions can assist clients who are admitting as well for a hold, or to travel with them to a higher level of care if they are moving to a higher level of psychiatric care, such as Menninger's Clinic in Houston. A companion will transport them there and make sure they arrive safely and do the entire intake process, as well as go and help them return home afterwards. We've even had companions go into homes while the clients are gone and help clean out all paraphernalia if it is an addiction case. Identifying a companion who has done work around grief and loss can be really critical for times when a companion is in treatment and needs to go home. If one of their parents has passed away, it actually can make all the difference in them possibly not relapsing during that visit. We also have companions who get to go home for weddings, things like that. That can also be a triggering event where people drink or use or go back into compulsive behaviors. Companions are equipped to assist with the clients in life skills to become more independent. They can gently help create a community for the clients with fellowship and support for clients, especially suffering from social anxiety. Recovery companions are no longer just for substance abuse. We find ourselves working with straight mental health clients on conservatorship cases, and recovery companions meet with the treatment team to help implement the daily goals of the treatment plan. Working with a client 24 hours a day in their home or their treatment care setting, recovery companions are the eyes and ears of the psychiatrist and the therapist. From a clinical perspective, the recovery companion provides an otherwise unattainable insight into the client's development from an unbiased perspective. Trained on proper medical management and logging and making sure they take medications as prescribed, it can also inform treatment team of what's actually going on behind the scenes. I myself have been a recovery companion for Connections in Recovery, working on some severely acute cases, and I've actually personally witnessed almost miraculous transformations. So the information that the companions are capable of providing to the treatment team is so helpful. And specifically, we are known for a rapid response. So one time Patty texted me, I was actually supposed to go to a luncheon, she texted me at 9 a.m. like, can you help me find someone? A young lady had gone rogue and was missing from IOP and missing from her sober living. And Patty sent me her photo. She sent me the last 3 places that the client had been contacting her mother from and a description of her car. I went and investigated all 3 locations. It was a new experience for me. And I, by using her photo, I found where she had been staying, and she wasn't there at the moment. So in my car, I watched the entrance of that location from across the street. You know, her family lived on the East Coast, so the parents with loved ones like that who are out here doing treatment, it's a very helpless feeling when you're so far away, and if you're going to jump on a flight right now, you know the expense of that, and you don't know the area. So that's where it's really critical that the family has a resource like Connections in Recovery. So as I was trying to figure out, I saw a car drive by with a young lady in it that had the same color hair, and as I was trying to figure out if it was her or not, she literally crashed her car into an LA City bus. And I parked, I got out, I went up to her on the curb and I said, "Hi, your mom sent me. I'm here to help you." And to this day, she calls me her Christmas angel. It happened like right around Christmas. She looked up at me, totally confused. She had an open container in the car. She had drugs in her pocket. She was absolutely obliterated. I sat with her on the curb. I discussed the situation with the cops. They ended up taking her into the station. I followed them to the station, and I was able to talk to the officer, the head officer on duty, and have him release her into my custody to take her straight into medical detox instead of going to jail. The family wanted me to stay with her in detox, afraid that she would run. We bonded over life events that we had in common during that time, and they asked me to stay with her and move into sober living, into a 2-bedroom there. And I actually stayed on the case for 5 months with her. I went home for a big life event with her. I helped her get into a volleyball league that sparked a passion in her. She had absolutely no job skills. She'd been out of high school for 5 years, and very few actual life skills like laundry, things like that I guided her through that process of learning. And I was informed by her mother recently that she's had her 2nd semester of straight A's in an online college. She has a job as a librarian that she's thriving in, and she has meaningful relationships with her family, including her son that she had put up for adoption during addiction. So it works. Connections in Recovery is a very vital resource for families out there that clinicians can share, that when we're here to support you, we're here to give you all the information about what's going on behind the scenes between your sessions with those clients. So I'm honored to work with Connections in Recovery, and to thank you all for being here today and to share that story with you. And now I would like to introduce to you Dr. Lauren Casey, who is also a dedicated recovery companion for Connections in Recovery.
Good morning, everyone. Thank you for coming. It's good to be here. London, that was great. It's always good to hear real life experiences of the work we do. And I was brought on with Connections in Recovery almost a year ago. I haven't looked back since. It's been amazing. I want to share with you the importance of this kind of work because I've done work in all settings. I've done groups and, one-on-one and everything, but I like this the best. I like to be the eyes and ears on the case. And I'm going to share with you 24-hour observation and support that I've done with another acute case in which he was a young man, 20 years of age. He had been across the country in and out of psychiatric hospitals, emergency wards for a very long time. He presented with up to 20 plus audio visual hallucinations. He had over 20 people in his body, around his body, spirits, and was unable to even hold a conversation, let alone, take out into public. So the family was desperate because they found that every time he went into a facility, he would leave worse. He would leave with more psychotic symptoms, and they were just at a loss. They had no idea what they were going to do. They did not want to end up locking him up permanently. He was their son, so obviously they were willing to do whatever they could. They heard about Connections in Recovery through his psychiatrist. He was referred, and then I was called upon on the case. So I'm going to share with you about that case, what's happened. He also had severe childhood trauma. He was living at home with a parent who was also severely alcoholic and had eating disorder as well. So there was a lot of trauma through the family, and then also I was right in that environment the whole time, like in with the whole chaos of what was going on. So before the family hired me, as I said, this client was in and out. And what happened when I came on board is I basically started working with a psychiatrist, and I became the lead on this case, working one-on-one with this client, starting out 8 hours a day to 12 hours a day, and then up to 24. And the case was so acute that another companion, the lovely London, was brought on to co-work the case with me because it was just so complex. Psychiatrists didn't even have a diagnosis. They couldn't even come up with a diagnosis because there was nothing really there were certain conditions, but they couldn't put any diagnosis. So I worked with a psychiatrist. I worked with medication adjustments that took place over several months. I worked with the client for nearly 6 months, and during that time, he was actually able to learn structure. He was able to develop life skills. He's now a gifted musician, and most importantly, the voices, the audio hallucinations from 20 are now down to 1. And the most importantly on this case is this client never had to be admitted to a psychiatric facility. And that is the power of the work we do. I can't say it enough. It's collaboration, it's teamwork. We work with the clinicians. Patty and Lauren and case manager Lauren Arborio are amazing. They support us through the process. And I know this client so well that I'm actually called onto, if there's something going on, a family event or anything like that. So that was an amazing case. So Connection Recovery's primary goal, as I said, is to make these groundbreaking services available to families and also future clients you may have or current clients you have. As the treatment industry becomes more familiar with recovery companions, there will be fewer incidents of individuals having to take multiple trips to psychiatric wards, which in our experience leaves families feeling as hopeless, if not more hopeless, than their family member. Psychiatrists and doctors have been suggesting our services. As I came on this case was through her lead psychiatrist. Through another one, a woman had a lead psychiatrist who also referred me. And so the wonderful work you're all doing creates a more personalized alternative route to traditional treatment regimens. Regardless of the diagnosis, Connections in Recovery can personally assist with the overall treatment goals of the client, providing hands-on support. We're here to give you the space and help you most effectively do your jobs. If you'd like to know more about companion work and the beautiful work of CIR, please talk to any one of us in the front row here, after the conference. Without further ado, I would like to introduce Dr. Don Grant. He's going to be our next speaker. He is an internationally award-winning media psychologist, chair of the American Psychological Association Device Management Committee, and the CEO founder of Unboot Camp, a treatment program for teens, young adults, and families struggling with device management. Dr. Grant, thank you.